Afib shock treatment 101, cardioversion procedure steps. Let's discuss the treatment options for atrial fibrillation, Afib, including the use of electrical cardioversion, often referred to as a heart shock atrial fibrillation, Afib. Afib is an irregular heart rhythm characterized by rapid and chaotic electrical signals in the atria, upper heart chambers. Symptoms may include palpitations, fatigue, shortness of breath, and dizziness. Electrical cardioversion, heart shock. Definition: electrical cardioversion is a medical procedure that uses quick, low-energy shocks to restore a regular heart rhythm. Purpose: it aims to convert Afib back to a normal sinus rhythm. Procedure: electrodes, paddles, are placed on the chest. A brief electrical shock is delivered to the heart. This stops the heart momentarily, allowing the electrical impulses to reset into a regular rhythm. Risks: skin irritation at electrode sites. The heart may not return to a normal rhythm, and Afib may persist. Blood clot dislodgement, prevented by blood thinners before the procedure. Other treatments for Afib *, medications, antiarrhythmic drugs, example quinidine, doflide, propafenone, to restore normal heart function. Anticoagulants, example warfarin, to prevent blood clots and stroke. Procedures: catheter ablation, destroys abnormal heart tissue triggering Afib. Atrioventricular, AV, node ablation, prevents abnormal impulses from reaching the ventricles, lower heart chambers. Left atrial appendage closure, device insertion to prevent blood clot formation. Maze procedure, surgical techniques to treat Afib. Remember, individualized treatment depends on the severity of Afib, overall health, and patient preferences. If you experience Afib symptoms, consult a healthcare provider for proper evaluation and management.